Hey everybody, welcome to this week's conversation sheltered in place. I'm really excited about this conversation. I have a very, very special guest, and I'm gonna read his bio here in a second. But he's one of the hero healthcare workers on the front line, working in New York City right now, which I think is probably, and we'll talk about this, but probably the epicenter for COVID-19 here in the world, I believe, at the moment. But I'm going to bring on Dr. Josh Davis. And Dr. Josh Davis was born in the Bronx, but he grew up in Rockland County, New York. He studied Romance languages at Binghamton University before obtaining his MD at New York Medical College. He completed his residency in internal medicine at... I got to move this over for a second. He completed his residency in internal medicine at the Beth Israel Deaconess Medical Center at the Harvard Medical School, and he served another year there as chief medical resident. After that, he began a fellowship in pulmonary and critical care medicine at New York-Presbyterian Hospital at Weill Cornell Medicine. Throughout his career, he's put a strong focus on medical education, including using technology like high-fidelity simulation. And right now, Josh is on the front line in the battle fighting COVID-19. And I am going to bring him in at this moment onto the line. And we should see him here in a second. So hey, Josh, how's it going?
Hey, Ron, how's it going?
Very good. Getting a little bit of an echo on your end. So just while people are joining, I'll share an interesting tidbit, interesting side note. Josh's mom, Tammy Finkelstein Davis, and I graduated from Roosevelt High School in Yonkers, New York together a few years ago, many years ago.
A few years ago.
So it's you know what? This is my issue on the audio. So let me take care of that. We've got a connection there, but thank you so much for taking the time. I know that you're really, really busy. We talked a little bit beforehand, and both of us hope everybody who's tuning in right now is safe, that their families are safe, that everybody's staying healthy, and everybody's getting through this crisis. And what we want to talk about is strategies to get through this crisis, ways that we can not only get through the crisis, but get through stronger, more unified than ever, to basically use this crisis as an opportunity to come together. And so that's what Conversation Sheltered in Place is all about, and that's what we're going to talk about. So Josh, can you just start off by just giving us a normal day down there at New York Presbyterian? Right now you're in your apartment, not far from the hospital, over
Right
on the Upper East Side of Manhattan. And can you just walk us through, what a normal day is down there right now?
Yeah, I mean, a normal day, in some ways is not very different from my normal day, in the sense that, it's coming to the hospital and working in an intensive care unit. I think the things that are pretty different from it, the normal day, are really a lot more critically ill patients, with sort of medical problems, not surgery or trauma or things like that, and a lot of patients that are in really similar conditions and similar situations of having a hard time breathing. It's kind of, it's impressive the way I sort of see it, is how quickly my colleagues have been able to mobilize and really allow for us to take care of the huge volume of patients, which is the big change of what things are normally like for us. I think on a given day, maybe there'll be 7 or so doctors from my particular division in the hospital, the pulmonary and critical care. Whereas now, with this pandemic and the number of patients who need our help, there's probably like 25 of us per day in the hospital. So there's a ton of people who are there, and everybody just really mobilized. So to me, it's kind of inspiring. And it's not just people from my division; it's people all throughout the hospital, honestly, really trying to use their expertise in a way to take care of patients as a team, like a really holistic way of taking care of everyone.
So, one of the things that we've been talking about during these conversations is managing fear. fear and stress and anxiety and everything else. And, all of the healthcare workers that are there with you are putting themselves and frankly their families in danger by coming there every day and working there. So how do you guys, is there any strategies for dealing with that fear, and what keeps you guys driven and motivated?
Yeah, it is scary. I think everybody really feels it. It's sometimes it just sort of feels like you're staring down danger or even, critical illness and death. And I think the best way that I've found to try to combat it, and this is what's worked for me, is just, when I am at work, is being able to rely on my coworkers who are all in the same situation and support each other in that way, and acknowledging that. I think the first thing, really just acknowledging that we are afraid and that everyone feels that way, and going from there to kind of say, like, this is our real world right now, as surreal as it feels, and to help each other get through it, just by really approaching things as a team and trying to laugh whenever you have the opportunity to eat whenever you have the opportunity to, which there's been no shortage of that. I think there's been an incredible amount of generosity that I've seen throughout the hospital, in terms of places in the hospital donating food, restaurants around the hospital donating food, and then throughout the community. One of the researchers, one of the PhDs in our division, set up a GoFundMe because she wanted to feel like she could help in some way, since she's not a medical doctor. And within a day, she raised over $10,000. And wow, since that point, she's raised almost $50,000, maybe even more by now, which has really just been to buy, all the doctors and nurses and respiratory therapists and aides and everybody who's helping to keep the hospital running, to buy food. So that, that's, I think, one way everybody sort of bonds over that. And the other part is trying to take care of yourself when you're not at work, and for many people who are working from home, it's kind of hard, because as I would imagine, I don't work from home very often, but I think the lines get blurred pretty easily as to what's work life and what's home life. So trying to really set boundaries as best as you can in terms of when you're gonna do your work and when you're gonna do your home life. And I don't know, I try to exercise when I can, even if it's just a short thing, or go outside for a walk and get some fresh air, wearing a mask, of course, but, just those things to try to give your day a little bit of routine. Because I think, the first few days of people being locked down, it sort of feels like a long weekend. And then week 2 hits, week 3 hits, and no one knows what day it is, and there's an impression in your couch, and I think trying to at least give a routine and not just treat it like a weekend has been helpful for me. I don't know, what have you found that is keeping you from getting stir crazy?
Well, all of the above, and getting out whenever I can in a safe way. Staying in touch with folks, using the technology that's available to us to stay in touch and to see, and to do that as much with video as we can, so that it's not just, a disembodied voice on a phone.
Yeah, for sure.
At least you could see facial expressions. But I want to open it up to the folks who are tuning in on Instagram Live. And if you have a question, if there's a comment you have or whatever, I also want to ask everybody if there's any problems with the audio or anything, let us know about it, because I am getting an echo, Josh, when you're speaking. But that could just be me. So, but if everybody's getting that, let us know. So let us. Hey, Laura, thanks for tuning in. Just, if you guys have questions, let us know. So I know that there's a lot of teamwork at the hospital right now, and a lot of folks are kind of stepping outside of their normal jobs, right? They're filling in, and can you talk a little bit about, the expansion of teams and and how people are stepping in to fill the gaps where needed?
Yeah, it's been really awesome. I think because the overwhelming majority of care in the hospital now is really dedicated to COVID patients, and not what it's normally like, where there's a full variety of things that we see in all areas of specialty and needs in the hospital. So, other services in the hospital that are not as busy now, because they're not seeing as many of the cases that they would usually see before all this. So they've been sort of not repurposed, but sort of taken their skills and put them to good use in a way to free us up to work on other things, or take care of more patients. So I think of the CRNAs, which is registered nurse anesthetists, which usually work in the operating room to help take care of patients undergoing surgery. They've been mobilized to now be a part of our intubation team to help when patients need to be intubated or have a breathing tube put in. So they're part of the team that can help manage the breathing machine, as well as all the medications, and help the anesthesiologist to put the breathing tube in. So that's one way that we've sort of mobilized them, and they've been amazing. They're really so helpful. Other areas in the hospital, some other doctors and doctors in training that have other areas of expertise. For example, I can think of our surgeons and interventional radiology doctors who have been helping to put in special kinds of IVs and lines for monitoring our critically ill patients. That's saved a lot of time for us to be able to help take care of other patients when we don't have to do some of the procedural things that we usually do to manage these patients. So we can ask somebody who has this, the same skill but is not otherwise occupied.
Yeah. Now, do you think these things are temporary, or do you think some of these that will carry through and become new procedures or new ways of doing business?
I think once things start to get back to normal, and I do think things are going to get back to normal, the bigger question as to when that's going to be, I don't know if anybody knows the answer to that. But I don't think that's. I think it's going to go back to how it was before, in the sense of people doing jobs in a different way, because I think the things that they usually do are going to start coming back into the hospital.
Yeah.
I think one of the things that's definitely going to stay has been the camaraderie between everyone, which has really been awesome. Because I think from what I've seen, is that we tend to practice medicine in a silo. Like you're in your area of expertise, and you work with the people in that area and the pretty close areas, and so people who are maybe not necessarily working as closely with you, you don't have that kind of working relationship. And so now I think it's been amazing to see this mobilization. I think, a lot of the words I use are things that are like, military type words, because it feels like a war, and it feels like you need to just recruit everybody and get everybody to be working on the same team for the same reasons.
Yeah.
I think that's going to stay.
So we had a question come in, and I apologize because it scrolled too fast for me to see who put it out, but I think maybe the phrasing of the question might give us some hints. It said, how long are you contagious for after you're being diagnosed, son?
I wonder who that's from.
Yeah. It could be from your mom. I'm not sure.
It could be from her. That's a really good question, and it doesn't really have a simple answer, because it sort of depends on when you got diagnosed. What we're generally recommending is that if you do have, if you are diagnosed with coronavirus, that you stay on quarantine for at least 3 days from the last time that you have had a fever. And that means, if you've been taking Tylenol and you haven't had fever, that doesn't count. You want to see that you don't have any fever off of any medicines, and at least 7 days from the time that the symptoms start. Everyone's heard the sort of 14-day quarantine period, and that's really been the recommendation, because most people almost all people will develop symptoms by 14 days after having been exposed to the virus. So I think that's why some people say, this 14-day cutoff, where it sort of means if you think you've been exposed, it's a good idea to keep yourself quarantined for 14 days. And if you don't develop symptoms after those 14 days, it's very unlikely that you caught it in that exposure. But if you do catch it, then 3 days from the last fever and 7 days from the onset of symptoms is generally the recommendation that we have now, at least.
Okay. All right. Pam Evans, 44, asked, what are hospital leaders doing to keep up morale?
They've done a lot of stuff, actually. First, they gave us, this is definitely not the case for all hospitals, because I've seen many hospitals where the healthcare team has had to take pay cuts, and actually pretty significant pay cuts. At my hospital, they actually gave us a bonus, which was very nice. And in addition to all of that, they've been bringing lunch every day all around the hospital to everybody. They have, in addition to all the construction that's been going on in the hospital to convert regular hospital floors into intensive care units, because that's how many critically ill patients we've had. They have also been building sort of like areas of like rest and recovery areas for people throughout the hospital, on all the different floors in the hospital, and this one large atrium area that we have in the medical school. So areas for when people to have a, can actually sneak away and get a break, can relax somewhere comfortable. There's, food and drink there, and televisions and places to charge your phone and that kind of stuff.
Yeah, it's interesting. The first conversation we had on Conversation Shelter in Place was with somebody named Jacob Marshall. And what Jacob's doing, along with his wife, Hajan, and a team of folks, they're down at Mount Sinai Hospital, and they're setting up restorative areas where, they have a projector that with a voice activated, you can select different scenes, a campfire, a beautiful stream. They have aromatherapy going on. They have really meditative music and lots of support. And I was talking to those guys last night, and I said I was going to have you on. I said, oh, if you guys want them to come set something up there, he might even be in. We'll see if he's tuning in. But we did the episode from Mount Sinai and in the space, and I think it's really making a difference.
That's really cool.
Yeah,
there's so many things that they've been trying to do to help give people, even if it's just like a mental break of 3 minutes, like when people come by. They've had some of our social worker specialists, particularly the ones that generally work with our pediatric patients, who have since been moved out of our hospital into the uptown York-Presbyterian campus, and they've sort of come by every day with a little trolley and a few people, and they're there to boost morale. They have a bunch of snacks and beverages and aromatherapy and all these kinds of things.
Awesome.
Which has always been a nice little, even if it's like a 5-minute, not even 5-minute break, to just take your mind off of things for a minute.
Hey guys, if we don't get to your question, then please send it again, because this is such an engaging conversation that sometimes I'm missing the ones as they come through. But I think what we're just talking about basically is self-care, right? Or in the space business, we talk about expeditionary behavior, and the first rule of expeditionary behavior is you don't do your team, or you don't do anybody any good if you can't function at 100%. If you're sick, if you're burnt out, if you're too tired, and so it's really important. You have a responsibility and obligation as a team member to make sure that you're firing on all cylinders. And it appears that the leadership in your hospital realizes that, and is trying to do things to make sure that everybody's firing on all cylinders. And so that just doesn't go for people working in a hospital. That goes for everybody. We're in a marathon, not a sprint right now, and we need to pace ourselves. We need to figure out how we're going to get through this in the long run, and we need to take care of ourselves. Okay, there's a long question there, and the first sentence of it I can't read. Many people are avoiding going to doctors if they don't have sufficient insurance coverage. And do you think it's a good system for the future? Medicare for all, is that what it is? I can't read the first sentence.
Yeah, so it says Medicare for all be beneficial in this time. Yeah, that's a good question. I mean, I have seen that, and I do think a lot of people, for a variety of reasons, are not seeking medical care, whether it's because they don't have good insurance, or undocumented people living, in the U.S. who are afraid of other repercussions by seeking care and identifying themselves as here. I think that is a problem. We've been hearing reports, at least in New York City, about lots of people dying at home, and it makes me worried that could be playing a role as to why people are not seeking medical care, if they're concerned about how much these things are going to cost them. I think my personal opinion is that healthcare is a human right, and I think that in a country as advanced as ours, that everybody should be guaranteed it for an affordable way, and that the primary intention of healthcare insurance should be to protect us as people. I think that's one of the obligations of government, is to protect us as their citizens. And I think healthcare insurance should have that same role, and that's the same objective, and it shouldn't be profits being the first objective.
Yeah.
So, I don't know what kind of system would work best for this country. I think it's not an easy question to answer because we're just such a big country and we're so different from all the other countries that have done it successfully. But I do think that we have to figure out how to make this work for our country.
So one thing to talk about real quick on that topic is, if everybody had access to healthcare,
Mm-hmm.
obviously each of those individuals themselves can benefit, especially if it's preventative healthcare, not, you're preventing
Right.
problems, not fixing problems. But how does that affect everybody else? I mean, so if I'm insured and I don't have to, why would I, how does it impact me if somebody else has health insurance? That's a
Yeah,
leading
I
question.
mean,
Admittedly, that's a leading question.
yeah, yeah. I mean, I think it leads us to a good discussion. I mean, on the most basic way I think about it is that when people are healthiest, and that's not just their physical health, it's mental health, it's everything, that they're able to participate in our society to the highest degree that they're capable of. And I think that just further enriches our own society by having it full of people who are happy and healthy and can, be useful in everyone's own unique way in our society.
Yeah.
So I think, and then, I mean, there's a lot of other arguments about costs and everything, and how that affects the healthcare system in general when you have a really large healthcare system, and when everybody's insured versus when people are seeking emergency care and things like that.
Right. Exactly. Pay a little bit now or pay a lot later type of thing.
Right, right.
So, and I apologize, I didn't see the name, but there was a question on what is the most effective medication.
That's another really $1 million question there. I think, we're learning more and more every single day. In fact, in the last 24 to 36 hours, I read three pretty important pieces of literature. And, I think there's been a lot in the news, from a variety of sources, claiming benefits from certain medications like chloroquine, which, by the way, is not a medication that we use in the US, and hydroxychloroquine, which is similar to it, which has been sort of touted as an anti-malaria medicine, which hasn't been used for malaria probably in 40 years. And nowadays it's more actually used to help treat people with autoimmune diseases like rheumatoid arthritis and lupus and many other conditions. I think that's probably been the medication that's had been the most buzz about. And I'll say that in my experience of just having given this medication to patients is it doesn't seem to make people better. And some of the data is sort of starting to suggest that now too, is that it doesn't seem to be necessarily harming people in a grave way. More people who are taking it have side effects, which is not surprising. All medications have side effects. Fortunately, the side effects from hydroxychloroquine, the majority of people who get them, it's more minor, but still, I don't want to have the stomach upset and all those things that go along with it.
Yeah.
Especially if there's no proven benefit. And so far, there really hasn't been much proven benefit, even in some of the better conducted studies that have come out in the last, 48 hours. And I was actually just recently talking about today with a friend of mine who's also a pulmonary ICU doctor, about just our own anecdotal experience and what we thought, of the medication. And in general, there aren't many viruses that I can think of off the top of my head that get better really fast with an antiviral medicine. Like the same way that a bacteria infection tends to get better pretty quickly with antibiotics. That oftentimes viral infections need to run their course in order for people to recover from them. And so that's sort of why it doesn't surprise me that the medicines that we at least have so far haven't really turned things around, since I think probably tincture of time might be one of the best medicines, at least for patients who have a more mild or even moderate degree of sickness from this virus. The people who are really, really sick in ICU, I think, is a different story.
And there's obviously a danger with self-medication too, where people are not taking the advice of experts.
Yeah.
And I'm in Tucson, Arizona right now, and in our town of Tucson a few weeks ago, a couple took what they thought was chloroquine. I think they ended up taking something else, but on the advice that they were getting over the internet, they thought that this was something that they could take to prevent themselves from getting coronavirus, and the husband died, and I know the wife was critically ill from from taking this up. So,
Yeah.
so misinformation is, not helpful in this
Yeah,
situation.
I honestly think misinformation has just been one of the biggest hindrances to really effectively managing this. Less so, I think, in the hospital, because I think many of us always have a healthy dose of skepticism when we hear medical information to say, like, how good is this information, and can we apply it to our patients? But I think the things that that worry me about the spread of misinformation is that people who come from a position of power. This is not just talking about people in politics, because I was thinking about this and saw some tweet this morning from Elon Musk, who have a voice of influence, meaning lots of people listen to them, but may not necessarily have the training or the knowledge or the information to make those kinds of claims. And I think that's where things are dangerous, is that if, in my mind, like, you should always defer to the person who's the expert in that field. It doesn't matter if it's medicine or not. If my car is broken, I'm not going to try to fix it myself. I'm going to bring it to the mechanic.
That's why
And trust what they
we're
say.
having this conversation.
Yeah, exactly. So, I think, like, misinformation is one of the things that really contributes to fear, sort of getting back to what we talked about earlier.
Right.
And so, in the way I sort of mitigate that is by really trying to actively avoid sources of misinformation. I do not feel that the White House press briefings have been giving us accurate information. I have been trying to read more information. There hasn't been a ton from the Centers for Disease Control as much lately, but more, through other, areas of reporting, like the New York Times, for example, and other sources throughout, across the world. So, I try to rely on those sources that I think are pretty reliable, and not from ones that are just going to sort of instill more fear, or misinformation. I think the thing that has upset me recently was seeing about all this protesting going on. And, I'm certainly not saying that we shouldn't express our opinions and our rights, but this isn't like any other normal time. The risk to going out and gathering in public is literally a life or death risk, literally, and not just for the people who are out there demonstrating, but for all the people that they love and care about.
And this is coming from somebody who's seeing people die every day from coronavirus, right? I mean, this is real.
Yeah, it's like, the conspiracy theories that have been sort of going rampant across the internet is just one thing that really scares me. And I think that people are hearing, oh, the curve is flattening, which does seem to be the case and is really, really encouraging to me. But I think what people may misunderstand is that the flattening of the curve means that we're getting to the peak, and the peak is not the trough. It's not the bottom of this.
Right.
It means that we're still getting new people coming into the hospital. We're still getting new sick patients who need to be intubated, and we're still losing people. People are still dying. Right. So, the peak doesn't mean that this is over. It means that we just need that what we've done this last month or so has worked, and we need to keep doing it. You need to keep staying at home and keeping the same precautions that have helped keep people safe over the last month.
Yeah. So a couple of questions came in that I'll throw them both out there so I don't forget. But unless I've already forgotten. But one is 6 feet enough, or does the virus travel more than 6 feet? The other question was, has there been any use of intravenous vitamin C? Has that helped?
Yeah. So I think the 6 feet recommendation is enough. And it particularly reassures me when people are wearing masks, which is now been, ordered, or I don't know what the word is for it, but that has been the rule now in New York State. And the Centers for Disease Control also recommends that everybody wear some sort of face covering. It doesn't have to be a surgical mask, and it definitely doesn't have to be and shouldn't be an N95 respirator mask. Those should be safe for us in the hospital. But even something as simple as a scarf or bandana to cover the nose and mouth. I have been trying to keep my sanity and get some fresh air, and I go outside every day for a walk wearing a mask. And I see people with the mask like up here and down here and on this, and it's not covering their nose and mouth. So I think covering of the nose and mouth helps to protect everybody else around you, and probably protect you a bit as well. So I would say that keeping 6 feet and wearing a mask are probably the two best things, and they seem to be effective. The curve is flattening. So And the vitamin C
Yeah.
question, we have not been using vitamin C. I know it's been studied in the past, not in the setting of COVID, and other types of critical illness, like septic shock, for example, and has not been shown to be effective. So we have not been using it because there's no data to suggest that it will help with COVID, and there's no data to suggest that it really helps with conditions like COVID either. So I think
Okay.
that's why we're not using it.
All right. A question came in asking how your hospital is supplied. You know, is there enough ventilators? Is there enough mask gowns? You know, what are there needs?
Yeah. We fortunately are doing pretty well when it comes to ventilator supply. I'll say a few weeks ago we didn't run out, but we got really, really, really close to running out of ventilators, like scarily close. I just got a notification that we just got another shipment of ventilators, which is great, and so we're able to distribute them amongst our York-Presbyterian healthcare system. I think, you know, do we have enough personal protective equipment? I think we have enough for what I consider the new normal. You know, prior to this, all masks, you know, there are single time use when you're going in to see a patient. You know, if you have a cold, if I have a cold and I come to work, I wear a mask all day long, the same mask, and it's to protect everybody else, not myself. And in other situations, sometimes you're wearing a mask for the opposite reason. Now there's enough. If my mask breaks, I can get a new one, but I can't get a new one until it breaks. And so that's not something that people are used to practicing with. You know, I had the opportunity during my residency training to practice medicine abroad in Botswana, which was an amazing experience. And you know, for many, many reasons, but particularly helpful now to sort of get used to and have had prior experience in practicing in under-resourced settings.
Yeah.
So we have enough. We could definitely use more. You know, once we get, I don't think I'll truly believe we have enough until we're back to the phase of being able to use single-use items for their single-use intention.
Right. And of course, that's one hospital. I'm sure every hospital is different.
Yeah, I think there's been the variety. I think most hospitals have had to reuse things, but there are other hospitals who've had nothing, who are really, really low. So I would consider us fortunate. Maybe that's just the optimist in me, but I would say that we're fortunate.
The Streaming Museum wants to know where we can find the most reliable, non-political information.
Yes, that's a great, and whoever that person is also included in their links, Dr. Fauci, who I think is a great source of information. He is definitely the leading expert in our country, and I would argue even in the world, in how to manage pandemics. You know, he's been doing this since the early 80s in the outbreak of HIV. And he really, really is an expert in this field, and I trust what he says as my, like, you know, absolute truth source. But I agree, all the other sources that you listed there are things that I also myself rely upon. The CDC, the World Health Organization, CNN, the New York Times are places that I usually get most of my information. The other stuff I'm getting information from is you know, the medical literature, which, you know, not everybody has access to, and so we try to hope that there are people reporting on that in a way that that's sort of just easy for everyone to read and know about.
Okay. Brett Davis 227 asks, does COVID-19 kill or does it lead to something else?
Well, it seems that the virus itself is what's causing a lot of problems. The thing that most people are really stricken with is really severe breathing failure, which is caused by injury to the lungs and, you know, the breathing system by the virus. So it's not the virus itself, but it's the effects that the virus has on organs. You know, the lungs being the primary one, but we've seen it cause problems with the heart. We've seen it cause problems in the blood vessels, like people developing blood clots, either in their lungs, in their skin, in their kidneys, in the brain, even leading to things like stroke. So, you know, we are learning every single day. We're getting more and more information about how this virus causes people to get really sick. So that's, I think, where we are today, and it could change tomorrow.
Right, right. So maybe to change the tone a little bit, can you talk about what happens every day at 7 p.m.?
Oh yeah, it's actually pretty amazing. I haven't taken a recording of it, otherwise I would share it with you, but I do open my window to it when I'm home. In New York, basically every day at 7 o'clock, there's been about 3 minutes of cheers and applause, people leaning out their window, banging pots and pans, I live just down the block from a firehouse. They're like blaring all the sirens. Somebody around me has a very large drum that they're banging upon, and everybody just sort of stops in their tracks if you're out on the street and is cheering and applauding for not just the people who are working in the hospital. I think that's sort of where it got started somewhere overseas. I think in Italy, people were clapping that they lived close by to the hospital. But I mean, I personally like to think that it's not just for all the hospital workers, but for all the essential workers, everybody who's risking their life, people who work in a grocery store, people who are delivering your mail and taking away your trash and recycling, all these things. Truly appreciate that. And the irony, I was laughing about it with a friend, is that at least for the healthcare workers, we're all still in the hospital at 7 o'clock. You know, when the shift ends at 7, it doesn't mean that you just walk out the door. You know, you have to talk to the person who's coming in for the night and give sign out. And so, you know, yes, you may end at 7, but you don't leave the hospital till 7:30 or 8. So, you know, maybe 8 o'clock would be a better time if I got to pick. But, you know, I think the intention is really awesome, and it's really heartening.
So this is probably that's probably a good story to segue into what you hope comes of this. You know, we're paying this horrible price, and because we're paying a price, we have an opportunity potentially to get a benefit from it, since we're paying the price anyway. So, what are some of the things that you hope come out of this crisis?
Yeah, you know, I think just some of the things that are, I think of it as sort of two basic categories. Some of it are like medical and health kind of things, and the other part is just like us as a community and a society. You know, I think some of the basic precautions would be great. So people should continue the very strong regimen of hand washing and wearing a mask in public. I don't think we'll have to wear a mask in public always, but particularly if you have a cold or are sick and are going out in public, other people don't want to catch your cold, just like you didn't want to catch it. So I think it's a good idea. You know, our society has embraced wearing masks less than other places throughout the world. So I think it would be great if we continue to embrace that. And the other part about
Especially
it
if it'd be a lot easier if we make it a fashion statement. If you know.
Yeah, exactly. Now they've become pretty fashionable. So yeah, I definitely agree. And then just again, trusting experts when it comes to anything, not just health. I think that's the way I live my life, is I trust the person who knows it best to help make it so that I can understand whatever the issue is. So
I think the other side of that coin too is not trusting people who are not experts when they're talking outside of their field of expertise. So,
yes,
or to at least challenge it before taking it at face value. And then coughing that
coughing with a mask though. Yeah.
Coughing that information out over the internet. So for everybody else to be infected by misinformation.
Yeah, I mean, I do think of misinformation as a virus.
Right. I mean, we have a responsibility. Each and every one of us has a responsibility before we put something out to make sure what we're putting out has been fact checked, especially if it's life or death type stuff.
Yeah, I could not agree any more strongly about that. And then the other stuff I think is like the stuff about our society. You know, the support that I've seen for people rallying together is just, you know, is really amazing. There are a lot of people who live, at least in New York City, and I've read and heard stories about it all around the country, who are homebound, who have a really difficult time just with their regular day-to-day tasks. And I've heard stories and I've seen people just really be amazing humans and buy groceries and delivering meals and food, has been just one really great way to help support people who are already struggling before all this, and now, you know, can sometimes feel like you're really just on the edge of a cliff, and one little gust of wind can knock you over. So, you know, that support of reaching out and checking in on people, especially who you think are having a harder time, and even the ones who you don't necessarily think are having a hard time. I think it's really helping to create and foster volunteership as well, which I think is just one of those things that really enriches our community.
Yeah, and I think, you know, maybe a first step towards that is to be more observant. You know, if you haven't heard from a neighbor in a while, or haven't, you know, usually you see your neighbor out putting the garbage out on Tuesdays and the garbage hasn't been out, you know, or whatever reason, if you notice that somebody's having a hard time concentrating, or, you know, have you been getting enough sleep? You know, are you okay? You know, asking those type of questions, I think is really important to basically be looking out for telltale signs that people are having problems or having issues or or being
Yeah,
challenged.
I think a lot of people also are hesitant to do that because they may not necessarily feel empowered to know what to do with that information. And I think, and that can be scary for people, especially if they're afraid of what the answer and their response might be, that they are hearing that somebody's having a hard time. And I think, I mean, that's something that I face often. And the way I just sort of think about it is just really trying to be a good listener. It's just listen to what people are going through, and echo their sentiments especially when you share those sentiments, and seeing if there's any way that you can particularly help them, whether or not it's physically helping them to do something or, offer suggestions, and just especially if someone's really in need, just trying to listen, I think has served me pretty well.
Yeah. Besides the daily 7 p.m. thing, are there any other things that give you hope for the future? Any
Yeah, I
other
mean,
things that you're
there's
seeing?
tons and tons of awesome things. So, I mean, the 7 p.m. cheers are really, really cool. Last week when I was walking into the hospital, somebody decorated the sidewalk, just with sidewalk chalk on the way into the hospital with a ton of positive messages for a few blocks worth of things, and actually some pretty nice art too. And then it rained, and then they came back and drew more new things, which has been really cool to just sort of like, as people are walking in and out, sometimes downtrodden at the end of it, eyes down on the ground, there's nice messages to sort of cheer you up, to remind you why you're here and what you're doing this for, and that you're helping people. And so that's been really cool. I've really loved to see that.
Yeah.
Um,
You kind of touched on this a little bit, and maybe it's worth diving in a little deeper. We've kind of redefined, not redefined, that's not the right word. We've exposed who essential workers are, right?
yeah.
And I mean, everybody's job is important. Everybody is a contributing member to society, or at least they should be. But in times of crisis, there are key professions that basically, we can't do without. And,
Right.
I've been in some professions where heroism is associated with it, whether you're fighting in combat or launching into space on a controlled explosion. So those are normally, traditional things that, heroism is applied to. But we're kind of redefining that. I mean,
Yeah.
our heroes aren't wearing space helmets right now. Aren't just wearing space helmets right now. They're wearing all kinds of other gear, and you touched on that. And so, how can we, coming through this as a society, how can we better value, the people who we are absolutely positively counting on right now to make
Yeah.
sacrifices and to put themselves at risk?
Yeah. I think it's a really good question. Like we were saying earlier, the definition of who are essential workers is not just people who work in a hospital. And, people who work in a hospital are not just doctors and nurses. There are so many other moving parts of the hospital, particularly of the clinical care team. Right now, at least, our respiratory therapists are always amazing, but they're in really high demand. Those are experts in how to manage and connect patients with the ventilator. And in addition to our aides and the pharmacists, everybody throughout the hospital, and then all of the non-clinical staff that help keep the hospital clean and functioning effectively, and then all of the myriad of people outside the hospital, people who are, like we mentioned earlier, people who work in the grocery store, people who are, delivering your mail, taking away the trash and recycling, people working at the pharmacy. In New York City, food delivery people have been really working really hard, and so many other types of professions that I haven't mentioned. Many of those people, particularly the ones who don't necessarily work at a hospital, work barely minimum wage jobs that do not give them guaranteed benefits, which includes healthcare. And many of these people are working multiple jobs just to be able to afford their basic expenses, to be able to support themselves and their families. And I think, and I hope that this whole crisis, which I'm not just meaning that to apply to economic, but this whole crisis that's totally shaken our planet, when we are putting it back together, that we can really consider how we're treating our essential workers and how we should be treating them. And I think part of that gets to the question that somebody mentioned earlier about universal healthcare. I think that is one component of it, that people should never be afraid that they shouldn't go to the hospital or to a doctor's office because they're afraid they're not going to be able to afford their health care, or that it could financially ruin them, which many Americans have been financially ruined from healthcare costs. And I think that it should be more than just that. I read a really great article today in the New York Times that was talking about a lot of the economic impact on all of this. And it cited a study where they noted 4 out of every 10 Americans are unable to afford a unplanned $400 expense. And that really shook me that many people in our country can't afford $400 expense. And that, we have been told and we've been touting that our economy is so strong, but why, if it's so strong, why are there so many people, like many of our essential workers, who live paycheck to paycheck? Yeah. That we're just not supporting our people the way that we should be and that we can be. And the reason for why that's the case, I think, is multifold, and it's not my area of expertise, so I don't want to proclaim anything because many of those are my personal opinion and I can't validate them as fact. But
yeah, so we've been having this conversation for a very, very long time, we as a country, and what my hope, just to piggyback on what you said, what my hope is that this crisis has opened our eyes to basically re-engage in that conversation in a new way that's not tainted by politics, a new way that looks at the long-term plan, that realizes, a lot of things that look good, on the next shareholder report or next election cycle don't make any sense when you talk, 10, 20, or start talking multi-generational. Yeah. And that we have the courage to set aside our differences. We have the courage to step outside of our special interests and our narrower interest and look at the greater good and look at it over a long time frame. And I think when we do that, and we can put our politics aside and we can put all our differences aside and use this as a jump off point, as a catalyst, to have a real conversation about how we can make sure that, these folks are not worrying about a $400 expense that they didn't plan for, or they're not taking an ambulance ride to the hospital because seriously they'd rather die than incur that expense. So and put that expense on their family. It's in this great country of ours, it's ridiculous that
we should be able to do better.
As some of our citizens live that way. So I want to start to wrap this up because we're Instagram's going to pull the plug on us, and I want to ask you to leave us with two words of advice. The first thing is, how can people get through this crisis in light of COVID-19? What precautions that can they take? We've talked a lot about precautions, but is there anything that one last bit of advice you want to leave people for, avoiding getting sick themselves if somebody in their family does get sick, how they can deal with that? I know you've been through some really disheartening and tragic situations with folks, and what strategies we can have to get out this on the other side and get out stronger.
Yeah, those are really good questions, Ron. I think the basic recommendation is still really good hand washing and wearing a mask when you're out in public are probably the best way, and staying home. Like, very huge emphasis on staying home, minimizing the amount of time that you need to get out of the house. Obviously getting some fresh air, running errands, but don't go to the grocery store every day. Try to limit it to once a week. All these types of things to limit your exposures to other people is the best way to protect yourself. It's kind of tough when somebody in your home may have gotten sick, and I have seen many patients and with all the same last name because they're all family and they live together who have gotten sick, and we've heard horrible stories of families who've been really sickened from it. There's no good answer when you live in a small space with somebody about what's the best way to isolate yourself. I think wearing a mask is one of the best ways to protect yourself, and I think keeping a 6-foot distance are the two best things that we know. How to isolate yourself in your own home, I think that's a more complicated question, and unique to each person and each person's home living situation. But I think, distance and nose mouth covering are the best ways to prevent that from happening. I think, the way I would sort of look at it, and if I had to, the advice that I give and tell myself on a daily basis, is that it's a daily basis, that it is one day at a time. All the news, all the information, the situation is changing on an even more frequently than daily basis. And so all we can do is just take one day at a time, and try to just take the best care of ourselves, which includes protecting ourselves when we go out in public, but also all the other things that we have to do to protect our mental and physical health at home, like exercising, eating well, and then, indulging a little bit too, because this is a really hard time. And whether or not it's indulging on something good to eat or just cutting yourself some slack, this is a weird time.
Yeah.
There's no other way to put it.
Yeah. We need to not take ourselves so seriously all the time.
Yeah, for sure.
Well,
yes, as the Yonkers girls have reminded us here, I think there's a handful of people from Yonkers that have been watching, and so I would be remiss if I didn't call them out. I think I'd be more than remiss. But
well, Dr. Josh, thank you so much. Thank you for the conversation and sharing your insights. And I know your mom is really proud of you. Your family's really proud of you. But we're all really proud of you, and we're proud of all of your colleagues, everybody who is on the front line, everybody who's making sacrifices, everybody who's putting themselves at risk for the greater good. That it fills me with incredible pride in our species. We tend to focus on all the negative stuff, but there's so much positive coming out of this. There's so much to be proud of. There's so much to rejoice in. There's a lot of, in spite of this horrible dark crisis, there's a lot of beauty coming out of it as well. And
I definitely agree.
I want to thank you for your part in all that. So.
Thank you for having me. This was really cool. I mean, I have heard about you and all of your exploring of the world and other worlds for a very long time, since I was a kid, and so it's really cool to meet a real live astronaut.
Well, thanks, Josh. Okay, everybody, thanks for tuning in. We're going to post this on the interwebs as soon as we can, and we'll see you next Friday. And send comments if there's particular people you want to see in a conversation. If there's subjects that you want, we've got all the social media channels, Facebook, Twitter, any way you want to contact us, we'll take it under advisement. So we'll see you next time. All the best.
Thanks again, Ron.
See ya. Thanks, Josh.